Good afternoon, guys. Now, today's discussion A, we are discussing when when brain imaging finally shows us what schizophrenia really is. Okay, I'm gonna go through the presentation I made for you. Please enjoy. For many, for more than half a century, schizophrenia has been treated as a dopamine problem. The narrow frame shaped everything: diagnosis, drug development, public perception, even the way families understood the illness. But the newest generation of brain imaging has, has delivered a revelation that should force us to rethink the entire paradigm in living patients. We can now see receptor level dysfunction that has nothing to do with dopamine at all. Using a highly selective PET tracer, researchers have shown a 13 to 19% reduction in eukaryotic M1 receptor availability across the very regions responsible for memory, executive function, and sensory integration. For the first time, we can watch the biology of schizophrenia unfold in real time, in real people, not in postmortem tissue or theoretical models. This is not a subtle finding. It is a biological signature, one that aligns with the cognitive fragmentation, the difficulty with working memory, the disorganization of thought that families witness every day, but that our treatment barely touch. A disease of circuits, not just chemicals. The implications are profound. If M1 receptors are impaired, then schizophrenia is not simply a disorder of dopamine access. It's a disorder of cortical integration for the brain's ability to coordinate information across networks. It is a disease of synaptic vulnerability. Where receptor rich regions, serotonin, GABA, glutamate, eukaryotic, show the greatest loss. This imaging work confirms what many clinicians have long suspected. The cognitive and negative symptoms of schizophrenia are not secondary, they are central, they are biological, and they are measurable. A new therapeutic horizon. The timing of this discovery is not accidental. It arrives just as the first Ukrainic based antipsychotic exo malign tros trospirum enters clinical practice. For decades, Ukrainic agonists were scientific curiosity, promising in theory, impossible in practice. Now, with receptor specific imaging, we can see from chemical suppression to circuit restoration. This is not instrumental process. It is a new era. Why this matters for public understanding. Schizophrenia has always suffered from a narrative problem. The public sees psychosis, families see disability, clinicians see complexity, but the biology it was invisible. Now with PET scan, with PET imaging, the biology is visible, and that vulnerability can reshape public perception. We can show receptor dysfunction on a scan. Schizophrenia becomes less of a mystery and more of a medical condition with measurable, treatable pathways. It becomes easier to argue for research funding, for insurance coverage, for early intervention, for humane policy. It becomes easier to explain to families that their loved one is not choosing disorganization or withdrawal. Their brain is struggling to coordinate the very receptors that make coherent thoughts possible. We stand at a moment when science is finally catching up to lived reality for or of schizophrenia. We can see the receptor loss. We can measure the synaptic vulnerability. We can target the biology with new treatments. What remains is the hardest part, changing the system. We need research dollars that match the scale of the discovery. We need regulatory pathways that encourage Ukrainic and circuit level innovation. We need public messaging that reflects the new biology, not the old dopamine. myth. We need to treat cognition, not just psychosis, as the core of the disease. Schizophrenia is not what we thought it was. The scans show us that. Now the rest of our system must catch up. Okay, guys, here's the second half of my presentation. When we finally see the synapses missing in schizophrenia. For decades, schizophrenia has been described as an illness of chemical imbalance, a phrase so vague it became meaningless. Families were told that dopamine was the culprit. Clinicians were told that psychotics were the answer, and patients were left with treatments that quieted hallucinations but did little to restore their ability to think, plan, remember, or connect. But now, for the first time, we can see what the illness actually does in the brain in living people in real time. PET imaging using a tracer that binds to a universal synaptic protein called SV2A. Reveals something startling and clarifying. Schizophrenia is a disease of synaptic loss, not metaphorical loss, not theoretical loss, actual measurable disappearance of the tiny connections that allow neurons to communicate. The hidden biology becomes visible. SV2A PET imaging shows that people living with schizophrenia have reduced synaptic density across the very regions responsible for the abilities the illness erodes. Frontal cortex, the masonry of planning, judgment, and working memory. Temporal cortex, the architecture of language, auditory meaning. Hippocampus, the gateway to memory and contextual understanding. Emotion related regions, the circuits that help us interpret and respond to the world. MRI scans often look normal. PET scans do not. Then it. Needs, like a city whose bridges have quietly disappeared overnight. This is not a subtle biological whisper. It is a biological alarm. Why this changes everything. When synapses vanish, cognition collapses. Though it becomes noise, memory becomes unreliable, motivation evaporates, the world loses its coherence, and these are not secondary symptoms, they are the core of the disease. And PET scan imaging proves it. For the first time we can show families and policymakers that schizophrenia is not a failure of will or character. It is a failure of synaptic infrastructure. The brain is literally missing connections. A new era for treatment. This imaging breakthrough arrives at a moment when new treatments, eucranic agonist, glutamatergic modulators, synaptic restoration strategies are finally emerging. PET scan imaging gives us a way to measure whether these treatments actually rebuild synaptic density, not just suppress psychosis. It also validates what many clinicians have long believed. Dopamine blocking drugs were never designed to treat the heart of the illness. They were designed to silence its loudest symptoms. Now we can target the biology that matters. The policy implications are enormous. If schizophrenia is a synaptic disease, then cognition must become a primary treatment target, not an afterthought. Insurance coverage must expand to include therapies that improve cognitive function. Research funding must shift toward circuit level and synaptic level interventions. Public messaging must change, replacing outdated dopamine narratives with modern biology. This is not just a scientific update. It is a moral imperative. Seeing is believing, and believing changes systems. For the first time, we can show the public what schizophrenia does to the brain. We can show policymakers why new treatments matter. We can show families that illness is not invisible. And we can show patients that the future of care is shifting toward restoration, not suppression. Okay, guys, that is it for you. I'm going to take a little break for some lunch, and I'll be back on after that. Until then, Gator Wellness, take care, folks.